Is limited biomarker access hindering brain disorder diagnosis? Is limited access to reliable biomarkers hindering the diagnosis of brain disorders? This is a pressing question in the field of neurotechnology. Biomarkers are measurable indicators of biological processes or diseases. They play a key role in early detection, diagnosis, monitoring progression, and evaluating treatment responses in brain disorders. Take neurodegenerative diseases like Alzheimer's disease as an example. These conditions involve complex changes in the brain, such as the buildup of amyloid plaques and tau protein tangles. Traditionally, diagnosing these diseases has relied on examining the brain after death, which is not practical for living patients. Relying solely on symptoms can lead to misdiagnosis or delays in diagnosis. Biomarkers found in cerebrospinal fluid, blood, or through imaging techniques like positron emission tomography scans have the potential to improve diagnostic accuracy. However, several challenges limit their clinical use. First, many existing biomarkers do not consistently differentiate between various brain disorders or between disease and normal aging. For instance, the presence of amyloid can be found in individuals who are cognitively normal, making interpretation difficult. Second, brain disorders often have different subtypes and rates of progression. This diversity complicates the search for universal biomarkers that apply to all patients. Third, some biomarker tests requiring invasive procedures, such as lumbar punctures for cerebrospinal fluid collection, or expensive imaging techniques. This limits accessibility for many patients. Blood-based biomarkers are easier to access but currently exist in lower concentrations and need highly sensitive tests. Fourth, many promising biomarkers identified in research settings have not been validated in large, diverse patient populations. They also lack standardization for routine clinical use. Lastly, many patients show overlapping pathologies, such as Alzheimer's disease combined with vascular dementia. This makes diagnosis challenging, especially when biomarkers for non-Alzheimer's dementias are often unavailable. The limited availability of reliable biomarkers can lead to prolonged diagnostic processes. This often involves excluding other causes, which can create anxiety and delay treatment. From a neurotechnology standpoint, advancing biomarker research is essential. This includes developing sensitive, specific, and non-invasive tests, integrating big data, and improving clinical implementation of blood-based tests. Enhancing access to biomarkers could revolutionize brain disorder diagnosis. It would allow for earlier detection, personalized treatment plans, and better monitoring of disease progression. However, overcoming current limitations requires ongoing research, innovation, and clinical validation. Only then can we translate biomarker discoveries into routine tools for diagnosing brain disorders.